They don't feel safe in the street, in their own homes. Now our Jewish community doesn't feel safe in our hospitals, betrayed by the very people we trust the most. Two Sydney nurses are accused of spewing anti-Semitic hate so vile it makes you sick. And police are right now working to authenticate the video, as those working in our hospitals are at pains to assure us this is an isolated incident.
I'm so upset that you're Israeli. Like, eventually you're gonna get killed and you're gonna go to Jahannam, inshallah.
It's vile.
Why do you think I'm gonna get killed?
It's Palestine's country, not your country, you piece
how are
of
you?
shit.
Disgusting.
One day, your time will come and you will die the most
Sickening.
We spread
listen to me.
peace.
Listen to me.
And you spread
when your
death.
time comes.
How are you doctors? Wait.
I want you to remember my face.
Okay,
so
okay.
You can understand
Gotcha.
That you will
I have a
die
question
the most
though.
disgusting death.
All right, for sure. I have a question though.
Yeah, what's your...
I have a question. Let's say an Israeli.
I
God
won't treat
forbid.
them. I won't treat them. I'll kill them.
And it's frightening.
You have no idea how many Israeli Khara dog came to this hospital and I sent him to Jahannam.
Jahannam is Arabic for hell.
The anti-Semitic video was made while the nurses, identified as Sarah Abu Lebdeh and Rashad Nadir, were on duty at Sydney's Bankstown Hospital and was uploaded by Israeli social media influencer Max Vifa.
I
For
literally
real?
sent him to Jahannam.
New South Wales Health Secretary Susan Pearce visibly shaken.
Never in my wildest dreams did I think that I would be standing here with two staff of the New South Wales health system having said such horrendous things.
Once they were identified, the nurses were immediately stood down. Health Minister Ryan Park.
One of the most vile, shocking and appalling videos I have ever seen.
Police are now investigating.
Those people subject to that investigation will not ever be working for New South Wales Health again.
Dr. Nick Coatsworth joins me. And Nick, it is a very dark day for your profession.
I think it is, Ali, for the whole of Australia's health system, really. I mean, you know, we're talking about Australia's public hospitals. They're places of compassion, they're places of healing, they're places that I've worked in my entire career. And to see two healthcare professionals take aim at the Jewish community and indeed the whole Australian community in this way by suggesting that they have harmed or will harm patients is probably one of the most appalling things I've seen in my career.
Well, it breaks that trust, doesn't it? And it makes me feel for people like yourself. You and your colleagues must be hurting.
I think people are hurting across the country, and it's not just in New South Wales. What we've got to remember is that a significant proportion of our workforce in Australia's public hospitals comes from overseas. And this is not just about the effect on the Jewish community, which has been catastrophic if you're a Jewish patient today, but also the effect on our health system, its multiculturalism, its diversity. And what I want to do is reassure people that I have worked with people, healthcare workers from all sorts of different backgrounds. They are compassionate, they're ethical, and I'm sure that these two individuals are absolute outliers, and we have to do our utmost to prove that to the Australian community today.
Yeah. If you look at what one of them said, I won't treat them, I'll kill them. Have you ever heard anything like this in all your years of medicine?
No, and it still sends shivers up my spine hearing you say it, Ali, just as it sent shivers up my spine when I heard it for the first time earlier today. And, you know, I've heard reports that, you know, people are apologising, people are saying it was a joke. I don't even want to go there. I don't think you could even contemplate that it could be a joke. It was said, in my view, very seriously. And I've seen what happens overseas, Ali. I've been in places like Darfur where you do judge the healthcare where people do judge the healthcare they give by which side that people are on, which ethnic tribe they're part of. It is a dark, dark place.
Nick, I don't think people probably believe that this is a rampant problem throughout our health profession, but there is this thought, if there are two, there could be more.
It is certainly not my experience in the slightest that there are others who feel this way. Because of the actions, the appalling actions of these two individuals, we now have to prove to the Australian community that this is not the case. But I still think there's a long way to go to regain the trust that was broken today.
Yeah, and look, there has been a strong vow from your profession today to stamp this out, but I do wonder, how do you do that? Because you can't exactly ask someone about their potential extremist views in a job interview, can you?
No, you can't, but there are markers, Ali, and there have been markers since October the 7th of healthcare professionals getting online and expressing anti-Semitic views to varying degrees. And those need to be investigated. It certainly can't stop, I don't think, and I don't think the Australian community and the Jewish community would accept this stopping with just the investigation of these two individuals. I'm sure there will have to be more.
Are you suggesting we need to take a deep dive into the social media accounts of all health professionals?
No, I'm suggesting that it has been raised in Senate estimates and with the regulatory bodies that there are some health professionals in Australia that may have overstepped the mark on social media in terms of anti-Semitism. And that there's clearly a thin edge of the wedge here, Ali, when we go from protests at the Sydney Opera House on October the 8th through to the unsanctioned flying of terrorist flags, through to the firebombing of synagogues, and now through to two healthcare professionals making the most heinous comments on social media. That is a pattern. And that starts from somewhere, and we're going to have to look into it.
And I think this is the thing, right? We never thought that would reach a point where it infiltrates our health system, where I'm sure you yourself, Nick, I mean, what you do is a tough job. You've probably had to treat murderers before, but you do it because it's your job. And when you hear now that someone might be denied medical care based on their religion,
Well, it's horrendous, and I have had that experience when I was overseas, when we had to treat government soldiers before the government soldiers permitted us to treat children because they were from a different tribe. I know very clearly where this sort of thing leads to.
They've been stood down while this is investigated. If proven, what should happen?
Clearly, you would struggle to find an Australian today who would look at what these two individuals did on social media and say that simply banning them from treating patients for their lifetimes would be sufficient sanction. I don't think you'd find anyone who thinks that is sufficient.
And look, investigators are right now combing through Bankstown Hospital's records to make sure no patients have been hurt, and there is no evidence of that yet. But do we need to cast the net wider to other hospitals?
I think it would be spreading alarm and fear to be going and looking at this in other hospitals where there is no evidence of it. So I think the approach that New South Wales Health is taking is the right one, and I've got every confidence in Susan Pearce and the Minister Ryan Park that they've started a healing process today with their comments. Susan Pearce in tears, Ryan Park, barely concealing his fury at what had gone on. They've started that, and I have every confidence they'll continue it in the coming days.
Nick, how does a Jewish person feel safe if they need to go to hospital tonight?
Well, because of people like me, because of the international medical graduates that I trained with over the past 3 months at Canberra Health Service and more broadly around Australia, from southwest Sydney all the way through to Western Australia. We rely on international healthcare workers who are ethical, they're compassionate. I believe Jewish Australians and all Australians are safe tonight. I also believe that we need to follow this investigation absolutely fully and make sure that the necessary sanctions are applied to these two individuals.
Yeah, and I'm so sorry this casts a cloud over the many, many wonderful doctors and nurses in this country like yourself. Thanks, Nick.
Thank you.
But his words were reassuring, weren't they?